Good morning, everybody. In my presentation this morning, I will talk about maybe for some of you a relatively new concept of syndemics, and I'll try to explain that as well, as it tries to combine different ongoing epidemics in one concept and look at the surplus effects of multiple ongoing epidemics on HIV infection in MSM and transgenders. But let me first thank a number of people that have been instrumental in this work, in my thinking, as well as in the collection of the data that I'm using to develop this theory and that I've used to develop this presentation. My colleagues from the field station in Bangkok, the Ceylon Community Clinic that we run in downtown Bangkok where we do our studies, and also the brain power of my friend Ron Stahl at the University of Pittsburgh, who introduced me to the syndemic concept, and who also introduced the concept of syndemics to the different ongoing epidemics of psychosocial health problems, etc., among heterosexual men in the United States. So what I will try to do in this talk is to explain to you the syndemic concept, to show the presence of numerous interconnected epidemics or syndemics ongoing among MSM and transgender. I will try to convince you with some empirical data of the reasonableness of using the syndemic concept. These data will come from the Bangkok MSM cohort study. It's a study that is conducted currently ongoing in Bangkok by my own group at the Ceylon Clinic. And I will try to, if time allows, to discuss some future directions where we may need to go. So the definition of syndemic, multiple epidemics or conditions interacting synergistically, producing an extra burden of morbidity and mortality in a population. Now, this concept is not very old, it's actually very recent. It was first used by Merrill Singer to describe the poverty and social problems that he saw in inner cities in the United States. And if you want to know more, there's a lot more. You can go to the CDC webpage. They have a dedicated webpage on syndemics, and the address is right here below. So related concepts are that you may hear sometimes, or may hear me talking about intertwining epidemics, linked epidemics, interacting epidemics, connected epidemics, co-occurring epidemics, comorbidities, clusters of health crises, and co-epidemics. What these have in common is that syndemic approach focuses not on individual epidemics, but the focus of syndemic theory, of syndemic approach, is where the epidemics interconnect, where they overlap and produce extra burden of disease. For instance, I have two examples here where depression and drug use come together, where depressed people using drugs and drug using people are depressed. There is an extra energy and extra morbidity potential coming to light, working, adding to the morbidity and mortality that there is already in the population. For those maybe with a more medical background, clearly where HIV and TB, for instance, come together, there is clearly an extra production of morbidity and mortality, as people with HIV who get TB and vice versa are so prone to extra morbidity and particularly also mortality. So different epidemics ongoing, they are sometimes, or actually always, related to each other in very complicated ways, with feedback loops and positive and negative relationships and developing over time. So it sets up a very complicated network, or a very complicated scheme of different epidemics that are interacting with each other in very complex ways and probably in incomprehensible ways. But the idea is that we try to find the extra energy, extra negative energy that occurs when multiple epidemics are occurring, and that negative energy as it is expressed in extra morbidity and mortality. And that's where we want to intervene. That's where we need to be if we want to make real strides in stopping or limiting HIV infection. So syndemic concept has been investigated in the United States, and I'm not going to spend a lot of time on it. The research we are doing in Bangkok is actually the first investigation that takes it out of the United States. And people over there have been following this with great interest. There are some examples in the literature from Stahl, Mustansky, Kurz, and others, and they're all dealing with MSM. We look at some data, some real data from Asia and the Pacific. So we're going to examine the syndemic associations between psychosocial health conditions and HIV prevalence and incidence among heterosexual men and transgender in Bangkok, in the Bangkok MSM cohort study. In this study, it's conducted at the Silom Clinic in Bangkok, and some of you may have been there. The data are collected through computer-assisted self-interview. Number of variables that we use for this investigation: history of forced sex, feelings of social isolation, suicidal thoughts or actions, use of drugs, club drugs, alcohol intoxication, and also another one is selling sex. And here we had some discussion also, but selling sex in the involuntary kind, so not the voluntary kind, but the sex as a negative, selling sex as a negative choice. Unprotected sex, not always using condoms, HIV infection, so we use biological data for that, prevalent infection, incident infection, and we also use statistics. I will not go in a lot of detail for those, but we calculated, since syndemic conditions need to be associated with each other in order to work, so we can look at that statistically, whether they're really associated. So we check for that with odds ratios, and only those conditions that are associated, they can enter our theoretical model. We look at HIV prevalence at baseline of the study, and HIV incidence. Those are the new cases that occur during follow-up, so the incident infections during the course of the study. And then we use something called as a syndemic count, which is we just add up the number of psychosocial health conditions that a person has. So they can range here in our investigation from 1 to 6. In the end it's going to be 1 of 5, because one of the syndemic conditions drops out because it's not associated with each other and therefore cannot produce syndemic energy. So we end up with 5 conditions. In this study we have almost 1,300 men, 27 years mean age at baseline, usually well educated, and usually live away from the family, live alone in Bangkok. And here are the baseline data, the baseline prevalence of psychosocial health conditions in this cohort of MSM in Bangkok. So you can see here history of forced sex, about 20%, suicidal thoughts or actions, close to 30%, feelings of isolation, meaning that they did not have anybody in their environment they could share their concerns with about their sexuality or other issues, almost 60%, alcohol abuse 13%, club drug use 15%, and almost 20% had a history of selling sex. Here are the interconnections in this diagram, the associations between the different factors, and we need to have them, otherwise there cannot be any syndemic production or syndemic energy. Here the results: unprotected sex at baseline, 57% reported having had unprotected sex in the past 4 months at the start of the study, and the HIV prevalence, the percentage infected at baseline, was 22.5%. And under here you can see the factors that are descriptively associated with these